Hello, my name is Professor Bill Kling and I'm here at the UIC School of Public Health. Welcome. What we're going to do today is introduce the concept of public health, public policy making. And what we're going to do today is define the forum for public policy making and the actors that are involved in the policy making process. So the forum and their actors. And we'll have a comprehensive conversation about those elements, and then we will also have supplemental PowerPoint presentations posted for your review. What I wanted to do first was give you a little bit of background on my policy making experience and how I got involved in doing policy work. I'm an attorney by vocation and have practiced law for about 25 years. About 15 years ago, I developed a law school course entitled Legislative Advocacy, where I train law students on the legislative process and how to work that process. That segued into a position here at the University of Illinois Chicago School of Public Health, where I teach master's students, doctoral students, certificate students, medical students, and others how to impact the public health, public policy making process. I really started my hands-on policy work back in the mid-'80s. I was involved in some work around the issue of stormwater management and helped draft some legislation and work that down in Springfield. Since then, I've been involved in issues ranging from substance abuse prevention, obesity prevention, environmental protection. In addition, I've been very passionate about working on educational issues, public education issues, particularly from the student side of the aisle. So for instance, here in Illinois, I worked on and drafted the Illinois bully statute, anti-bullying statute, the first one that was enacted in the state of Illinois. So very proud of that work. I've done policy work at the local level, the regional level, the state level, and the federal level. And I am, again, very proud of my work and really, as it relates to, really supporting community, supporting public education, supporting public health. So just a little bit of background on me. You'll hear more as I give examples of my work, and you'll see my work posted on our resource site for your edification. So what I wanted to do today was kind of briefly introduce this concept of the forum, public policy making fora, and the actors that make up that are in charge of the process. First and foremost, I wanted to talk about what is a public policy, what kinds of public policies are there, and what tools do policymakers, and particularly public policymakers, use to create these formal public policies. So some examples, and I'll be using the whiteboard, some examples of public policy are legislation in the form of statutes and ordinances, regulation in the form of rules and regulations. We also have executive orders, and we have guidance. And also on the legislative side, we have resolutions. In the international context, we talk about treaties. And of course, there are others. So hopefully that gives you some idea of what I mean when I use the term public policy. These are formal policies adopted by legislative or executive entities. I'm not talking about privately developed policies that operate, say, a workforce, a workplace, for instance. I'm not talking about policies that hospitals adopt to run their hospitals, or corporations adopt to run their corporations. I'm talking about public policies, okay? So I'm going to erase these, and hopefully, again, I will be posting these types of public policies in our resource room, our virtual resource room. So what I want to do is further define what I mean by the public policy making forum, or what I call the public policy making infrastructure. The public policy making infrastructure. And what I like to do for students is put out there for you a framework by which you can visually see what I'm talking about. So when I talk about the public policy making infrastructure, I'm talking about a rather two-dimensional framework, a matrix, if you will. And in that matrix, are these categories. There is the federal policy-making infrastructure. There is the state policy-making infrastructure. There is the regional policy-making infrastructure, and there is the local policy-making infrastructure. We also have the international policy-making infrastructure, and I like to just add another one for fun, really, to talk about, just to kind of expand your mind and your thinking a little bit. And this is what I call extraterrestrial. I'd like you to think about Star Wars and Star Trek and some of the science fiction that we've seen, and think about the governmental infrastructures that were created in that science fiction. But what I do like to point out about the extraterrestrial, and for you to think about, is that, first of all, that might be our future, many, many generations from now. But also I'd like you to think about extraterrestrial in the terms of the amount of funding that goes towards extraterrestrial projects like the Mars rover and the moon project, and we have the space station. So many, many billions of dollars have gone into kind of extraterrestrial public policy, and I don't want to overemphasize it, but I think it's kind of provocative to think about. So these are the kind of categories of the policy-making infrastructure. Now, and what I want to do is briefly go back and give a review of the constitutional branches of government. So you'll recall from your 8th grade civics class that we have the branches of government. The executive, the legislative, and the judicial. Now, all of these branches are involved to some degree in the public policy making process. The legislative branch is really the technical side of drafting and approving through a really rigorous process, public policies, which are then approved by the executive branch. If there's challenges in terms of interpreting those policies, that's where the judicial branch comes in. In terms of our infrastructure, I'm not really going to spend too much time on the judicial branch. I would, however, put a footnote in there that more and more in our political environment, judges are elected and therefore get involved in the political process, which is directly related to the policy-making process. What I'd like to talk about is the balance, the delicate balance between policy and politics. So what we're going to do now is really explore the executive branch and the legislative branch and lay it out in the framework, in this two-dimensional framework. So at the federal level, for instance, we have the executive branch, which is composed of the president, the vice president, the cabinet, the agencies that flow from the cabinet, and then the independent agencies. We also have some very important components for advocacy purposes in the executive branch that a lot of people don't think about in this framework, but I feel are particularly important. And those would be the first lady and the second lady. As you know, as a great example is the importance of Michelle Obama's Let's Move initiative in the context of the obesity prevention conversation going on around the country. Now, while the First Lady does not have constitutional powers, we know that she has the ability to impact the system because of her position. And more First Ladies are taking a critical role in the policy-making process. Laura Bush was involved in literacy. Of course, Hillary Clinton was involved in healthcare reform the first time around and other issues. And now we have Michelle Obama, just three examples. We can go back to Lady Bird Johnson, for instance, who was very, very involved in the Highway Beautification Act, and other First Ladies that have been involved as well. So I don't want to, again, overemphasize the importance of these actors, but I do want you to keep them in mind as you're thinking about the public policy making infrastructure, and particularly as it relates to public health. So you have the president, the vice president, the cabinet, and the agencies that flow from the cabinet, the independent agencies, the first lady and second lady. I will be posting an assignment for you to review the governmental website, and I will show you how to access that through Thomas, THOMAS.LOC.gov, and I will give you instructions on how we can navigate through some of these cabinet positions. That'll be an assignment for further discussion. So that's kind of a brief overview of the executive branch at the federal level. Erase that and move on to the legislative branch at the federal level. And as you'll recall, we have a bicameral system. We have the Senate and the House. The Senate is comprised of 100 members, and the House is comprised of a varying member based on the census. The census drives how our House of Representatives are elected. And as you know, we recently had the 2010 census, and all the states are in the process of creating their remapping, the remaps, I should say, of their congressional districts. So it's a very kind of interesting process, how we get our House members and how those borders and those boundaries, those legislative districts are determined. And again, I'll be posting an exercise in terms of looking at legislative boundaries. So we have the Senate and the House, and then within the legislative branch, the Senate and the House have committees that they serve on, and they also have caucuses based on their constituent and interest, terms we will come back to in the next session or the session after that. So for instance, there might be the Congressional Black Caucus, meaning that these are individuals that are African American congressmen, or the Latino Caucus, or the Women's Caucus. We also have kind of interest-based caucuses. There is a caucus, for instance, on things like physicians and diabetes and other types of caucuses. So these are formal, and these are informal. We also have staff that comprise the legislative branch. Now, of course, as I mentioned, the legislators themselves, the policy makers, are elected. The staff are appointed. And again, as we look back and think back about the executive branch, there are individuals that are elected, for instance, the president and the vice president, and those that are appointed, like the cabinet. So that's a brief overview of the federal infrastructure. Very brief overview, but we will supplement with some assignments on navigating, drilling down into that process. So we have the executive, legislative. And what's great about our American political system is that there's consistency, there's patterns that flow downwards through our governmental infrastructure. So for instance, there's an executive branch at the state, which is the governor, agencies, and other officials. And don't worry about my handwriting, because I know it's terrible, but I will be putting all of this in our resource room. And then of course there's legislative, and each state has a little bit different setup for their state legislative branch. In Illinois, the website I will ask you to look at is ilga.gov, and as we get to know each other, if you're from other states, we'll be looking at your state's legislative website as well. So again, most states are bicameral with the Senate and the House, and again, the other elements that are practical but important, like the staff. And again, at the regional level, we have in Illinois and other states, county. And county is regional in the sense that it comprises several municipalities. And one of the interesting things about counties is that they oftentimes have a lot of impact on public health and public health policy. Again, there's an executive and a legislative branch, and we will again be doing an exercise to define those. And at the local level, we have municipalities, cities, villages, towns, and other entities. And again, there's an executive and a legislative. Now, as we move kind of up the chain at the international level, we really kind of have the UN, which is a volunteer organization that develops treaties. And again, we'll be looking later on in the course at the elements of the UN just as an exercise. And so it's a little bit different animal, but I'd like to put that out there because I'm very interested in the worldview, the impact, particularly of public health policy on global health and global issues. So that's the two-dimensional. And again, I'll be posting all this in our resource room. Now, there's a third dimension, which I'm going to touch on briefly today, and we'll cover more in the sessions to follow. But what I'd like to do is kind of draw it out there as a graphic. So you have the governmental structure that we just reviewed. So we have local, regional, state, and federal. Now, what lays behind this in the practical, real world of public policy making is another level, another matrix that lies behind the governmental structure. Something like that. And what that looks like is this. I'm going to erase this. And again, I will have a graphic posted in the resource room to help you understand that. But this matrix is the non-governmental entities that impact the public policy making process, or what we often call stakeholders. And there's nothing more important as we move forward in this course than the understanding of how to effectively engage stakeholders and how to do a strategic stakeholder analysis. So that is a key element. Now, just briefly, and we will have time to do more exercises on this, but I just want to introduce the concept. We have entities like business and industry, we have, on the other side, unions, we have professional associations, we have trade groups, and we have constituent organizations. We have research, universities, and think tanks. And then we also have the media, for instance, is a stakeholder in the conversation. We have, oftentimes people want to list lobbyists, actual hired guns on this list as well. It's an infinite list, and as we'll see moving forward, we'll fill in this matrix. But again, the bottom line is it adds a third dimension. Now, in our further conversations, what I'm going to do is give you a flavor of what I call the fourth dimension. So we have kind of the two-dimensional governmental infrastructure. We have the third dimension, which is the non-governmental stakeholders that lie behind the governmental infrastructure and really support the public policy making process. And then we have what I call the fourth dimension, which is how to feel, hear, touch the policy making process, the who, the how, the what, the where, these questions that really bring it into, real life. And what I like to analogize is, and I'll end today on this note, this concept that there's these new IMAX theaters that are kind of four-dimensional, where you're sitting there in the seat and things kind of fly at your face, and you can feel the wind underneath your feet that are supposed to be like rats running by, and then they spray water on your face. You feel it. And that's what I want to get you to by the end of this course, is the feeling of how the public policy making process works. So beyond the two-dimension, beyond the three-dimension, into the actual advocacy and work of the policy making process. So with that, that's our introduction. And I will be posting materials and exercises for you to do, to look at various websites and navigate through the process. So thank you very much.